Thank you. So we're going to open tonight's meeting. It is September 1st of 2020, and I will call the meeting to order. Jan, do we have anyone that is signed up for open forum?
No, ma'am.
Okay. If not, we will move along to agenda item number 3. If anyone has a question about the minutes, and if not, Chair would entertain a motion for approval of our consent agenda.
I move to approve our consent agenda.
I second that.
Okay, it's been moved and seconded. If there's no discussion, all those in favor, please say aye. Aye.
Aye.
Aye.
Okay, motion passes. And we're going to move along to number 5, our regular agenda. Item A is receive a report, hold discussion, and give staff direction regarding the current COVID-19 situation in our community. We have our Fire Chief, Keith Kiplinger, with us. Good evening.
Mayor and Council, thank you. Keith Kiplinger, your Fire Chief. I will try to be as concise as I possibly can. I'll also try to go as slow as possible to allow you to interrupt me if you want me to stop or you want to talk about something on one of the slides as we go through this. This evening's goal is to provide you with an update on activities, a current situation report, and highlight the changes in reporting that will be taking place over the next couple of days. Also, staff would like some feedback on what additional information Council would like to see and any steps that you believe we should be taking. So currently, staff is working on a number of projects to support our community, supporting long-term care facilities with personal protective equipment, supporting local business by providing guidance on CDC recommendations and state-issued COVID orders, supporting city staff by encouraging compliance with best practices and providing sufficient personal protective equipment and the necessary safeguards to keep our workers safe. We're working to improve health and safety by upgrading our city facilities. We're preparing for an unknown future by maintaining relationships, updating plans, warehousing, and ensuring access to personal protective equipment and monitoring the situation on a daily basis. We're also providing essential city services effectively and efficiently. So we'll start with a little review of the hospital data. Now, this is the current hospital data for Nacogdoches County. You'll notice the green line represents the total hospital census. That's the total number of patients in both of our hospitals. The blue line is the COVID patients in general beds. The red lines represent the COVID patients in ICU. And you'll notice that the ICU beds, the high was 15, and today we're at 8 COVID patients in our local ICUs. You'll also notice that the total hospital census doesn't always track with the peaks and valleys of COVID. And that's because the hospitals are full of a lot of other patients. And so today there's 117 people in the hospital, and only 27 of those are represented by COVID patients. The ICU data is something that you hear talked about across the nation. Certainly with the situation as it happened in New York, ICU beds became a really critical component. And since the COVID-19 pandemic began in our community, we've reached total ICU saturation on one day. That day, we did not go beyond the 22 normal ICU beds that we have staffed on a regular basis. We do have the ability to surge to 26 beds very quickly in among our 2 hospitals. And today we're at 8 COVID patients and 14 total patients in the ICUs across our community. Our general bed data, again, we have 170 beds as a general basis in our community with the ability to surge to 204. General beds in use total is 103 today, and of that number, 27 are suspected or confirmed COVID patients. So taking a look at our new cases, and what I think is the most useful is the trend line. Our new case average was over 30 per day at its peak, and today it's averaging 8.5 to 9 new cases per day in Nacogdoches County. Even more useful than the 7-day trend line, I think, is this 21-day trend line, which really shows you what's happening in the community. And because we're a smaller community, the 21-day trend line allows us to have enough cases to give relevance to the number, to the information. And so you'll see that the trend line trails the giant spike in late July. That at the trend line, it picked up that spike, but the trend line doesn't top out until sometime in the second week of August. And so I think that's probably the most useful data that we have. Excuse me. So taking a look at cumulative tests and cases, this is the total number of tests that have been administered since the beginning of COVID, and the total number of new cases that have been reported to us since the beginning of COVID. To date, we've had 11,628 people tested in our community out of a county population just over 65,000. We're averaging 89 tests per day, and our positivity rate is about 10.9%. That's the 7-day average of new cases to the 7-day average of new tests. So about almost 11% of the people that test are testing positive right now. The Department of State Health Services estimates the active cases in our community on a daily basis. Our high was 395 on August 5th, and we're down to 102 estimated active cases in the community today. Again, you can see the green 7-day moving average and the red 21-day moving average. And both the 7-day moving average has ticked up just a little bit in the last week, and the 21-day average continues to trend in a good direction. So how do we compare to the balance of the state or other communities? It's hard to tell how we compare just by looking at case numbers or one snapshot on one day. But the easy way to do that is we take the population of Texas and the population of Nacogdoches and adjust them for a 100,000 population number. And so doing that, we're able to really take a look at the millions of people in Texas compared to the 65,000 in our county by pushing that to 100,000 and pulling the state down to that. And so looking at that, we know that we've had just over 2% of our county population has tested positive for COVID at this point. Our total case number is 1,354 cases, and that represents, again, about 2% of our 65,000 or so residents. So looking at Nacogdoches versus our surrounding area, the heavy purple line on your screen is Nacogdoches. Again, these are based on 100,000 populations. It's hard to compare Angelina County and Nacogdoches County or Shelby County and Nacogdoches County because of those population differences. And so by pushing these to 100,000 average, we're able to really look at where we are. And you'll see that that Angelina and San Augustine counties have higher case counts than we do. And at this point, Rusk and Shelby County both have lower case counts than we do. We've been in the middle for quite some time. So taking a look at our data and the way we've been reporting data since we threw this together in middle of March, county emergency management coordinator receives a call generally once and sometimes more times a day from the Department of State Health Services regional office in Tyler. And they provide a list of cases, a list of deaths, and a list of their estimated recoveries. At the same time that happens, the Department of State Health Services headquarters in Austin reports out tests, cases, deaths, and recoveries on their own website. The DSHS Tyler numbers and the DSHS statewide Austin numbers often don't match. And for some time, we've had a lot of difficulty, really since the beginning, reconciling those numbers. Generally speaking, the Austin numbers lead our numbers, both in tests and confirmed cases and recoveries. And we started recognizing those discrepancies. So if you take a look at the top right of your screen, that's just taken from our dashboard. And again, This information was coming from the state office in Tyler and being pushed to us. And today, that number was 1,316 cases that Tyler had reported to us. If you look at the left, a snapshot circled in red again is the Texas Department of State Health Services Austin headquarters website today, which shows 1,338 cases. So those never match. The other thing is that the number of cases that we had reported to us as of yesterday was lower than the fatalities that were reported and reflected and have been on the DSHS state website. And the social media has had lots of discussions back and forth about why our numbers don't match. And we've really spent several weeks trying to reconcile that. And the folks at the county have worked really, really hard trying to do it. And what we've come to realize is that the numbers just aren't going to match. Something's missing, something didn't get communicated, that those numbers are not going to match. And so moving forward, we're going to switch to a system where we utilize the DSHS Austin numbers as once a day as they reveal them on their website. So if you look at fatality reports, this is the fatality reports as they were reported to us. And if you will look as we rocked along, we had the blue is what Nacogdoches was reported, what the DSHS and Tyler called and told us about. And the red lines represent the fatalities that were being reported on a daily basis in Austin. In some cases, it's taken more than 90 days for us to be notified directly of a fatality. The county didn't even receive a phone call for 90 days or 3 months. So the Austin data is certainly more timely. It's very difficult to reconcile this data because we don't own the data. It's all the state's data. And so effective today, we're going to switch to reporting the state data off of the state's online information portal. And I think that's going to give our citizens a lot more timely data. If you look at this tall blue line where 14 fatalities were reported to the county on one day, well, you realize that all those little lines leading up to that is what was reported all at one time. And so by reporting them on a daily basis, we'll be able to give people more accurate information about what's really going on here instead of these bulk downloads, if you will. So just a couple more things, and then I'll be happy to answer any questions, and I'd like to seek some guidance. SFA students are one of the biggest questions that I get. Where do SFA students fall in the reporting category? If 100 of them test positive, will it show up in our numbers or will it show up where they live? So cases are reported to us based on where they say they live when they go to get a test. So if they have a driver's license that says they live in Plano and they use that driver's license when they're getting their test, and that's what's recorded on the paperwork, that test will be assigned to Plano. If they say they live on Pearl Street, the Pearl Street address in Nacogdoches will be where that case is reported. But SFA has gone above and beyond, and they have a requirement that all students that test positive, faculty and staff as well, must report their positive test to the university. At the website at the top, sfasu.edu/fall2020 is their open SFA guide, and on that site is a current active listing of all positive COVID tests related to the university. So while we don't know whether or not the state is going to report those to us, because we don't know what the students are filling out on their test forms when they go to the hospital or the clinic, we do know that SFA is tracking that data. The next thing I've heard lots of comments on is what about school districts with schools reopening? So the TEA and Department of State Health Services have announced that at the end of September, they'll start reporting weekly cases by district. And the methodology that they're going to do that by is going to come out on September 8th. So they have not published exactly how that's going to work as yet. But I'd like to as I kind of conclude my comments, I'd like to thank Judge Sal and Mayor Brophy for their leadership during this unprecedented time. I also need to recognize the hard work of a lot of people, but especially Tara Triana and Abby Scorsenelli at the county, and Michael Self, Brian Bray, and Amy Mahaffey at the city, who have really kept us abreast of what we need to be doing and made sure we're on go. So of course, I'll be happy to answer any questions, but I have a couple specifically for you. What level of detail would you like to see, and what else would you like to know that maybe we're not providing you? And also, what would you like staff to do in addition to what you've heard tonight? And I'll be quiet and take your questions.
Okay, thank you, Chief. Let's start with Roy Bolden. Mr. Bolden, do you have anything for the Chief?
I just have one question in regards to the schools. In one of your earlier slides, you stated that you would be supporting the schools. Could you detail that a little more?
So what we've been doing to support the schools is trying to help educate them on best practices and make sure they understand those practices as they come out from the state and the CDC. And we've also provided personal protective equipment for the school nurses that were short, so face shields and gowns and masks and things of that nature. I also anticipate that we will be involved in keeping masks and gowns and those things available to them in the future. So the state is pushing a lot of that material to our city and county team, and then we're able to locally distribute that as we need to.
Yeah, are they providing you information as like on September 8th, 9th, or whenever the schools start, as to how many expected students they're going to have versus online?
I have not seen that information yet, but we'll seek that out.
Okay, thank you, Chief.
Jay Anderson.
Yes, I had one quick question, but before that, I really want to say thank you and Tara Triana and everybody who has been working so hard to keep all of this information as available as possible and as accurate as possible. And having to go through last week in addition to that, I'm sure didn't make things easier. My question is, do you have a notion, just roughly, what our total daily testing capacity is here?
I'm going to say that our daily testing capacity normally is probably 300. And I base that on a number of days that we hit 300 or even 400. And we did have tests exceeding 300 for multiple days. So I'm going to say that we can do that. We can ramp up to 300 without any extraordinary measures. I'll also say that if we need extraordinary measures, we can have state testing back in here within 2 or 3 days, and that testing capacity would really double that. And so you could be looking at 600 to 800 a day is what we would do if we peaked and we really needed the testing capacity. But we're doing I think I said 89, about 89 tests a day is what we're averaging right now. And those are primarily between Medical Center, Memorial Hospital, East Texas Community Health. And that's the
Okay.
those tests.
Does that include SFA's capacity as well, or is their capacity considered separate, or is it considered part of? Okay.
It's all within our own. But again, if there's an outbreak, anywhere, like we had an outbreak in the nursing home, and the state very quickly sent us in a testing team that tested all of those nursing homes in mass within 2 or 3 days. And so that testing capacity is out there, and it's actually caught up in Texas. They have a private contractor that's doing some of that now. And so we went from using firefighters and Texas military forces folks to now we've transitioned, the contractors have been able to catch up. And so that capacity exists. And there's a path to get it.
Great. Thank you very much.
Okay, Amelia Fisher.
Yes, ma'am. Thank you. Thanks, Chief. Do you know how long it's taking to get test results back? Is it taking an inordinately long time or less than it used to?
It's taking somewhere between 45 minutes and 72 hours, depending on the test type and the lab that you're using.
Okay.
So generally, those tests are coming back within 72 hours now. We had a city staff member who's on the call tonight that tested, and I think her test results took 8 days to come back a couple of months ago. And so that's absolutely, you're already past the window
Right.
of or go back and do anything. But really, we're looking at probably on average 36 hours. But some of the tests are really quick, and some of them, the labs are, they get a little behind.
The 45-minute thing, I'm assuming that's the finger prick test, like the rapid test that they're talking about. Is that right?
So there's several different kinds of rapid tests. And one of our local hospitals is using those rapid testing all the time, the antigen tests. There are several different ones. And so there are probably 10 different test models that are out there now, depending on what they are. So the antigen is picking up, the antigen test picks up things that the virus sheds, the waste left behind by the virus, basically, I'll call it. And then the antibody test, which tells if you've built up the antibodies from having COVID and you've already had COVID, that's the other test. And then the PCR test, which is the chain reaction test, which is basically testing the DNA of the virus. So, and each of them has sort of different parameters.
Okay. And you mentioned that there's about almost 11% of the people that were testing or testing positive. Do you have any idea how that compares to state numbers? State numbers like surrounding county or nationally. Basically, where I'm asking where we're trending along the percentage line.
On the positivity rate?
Yes, sir.
I don't, but I have all that data in a spreadsheet, and I can put together a graph in 5 minutes.
Okay.
I'll have it to Mario before you get off this call.
Okay. Just a couple more for you. Do you know how, and this is a question I've had for a while, do you know how they are estimating recoveries? Because I don't know if you just give a certain amount of time and then see if you've heard anything. I don't know how you would guess that. So
it's algebra, and I'm not going to pretend that I have the formula in front of me, but it is based on, were you symptomatic or non-symptomatic or asymptomatic? So an asymptomatic person, they have a particular length of time that they will draw that out and say that's how long we estimate that they're infectious. If you're symptomatic, that's a different number. And if you are hospitalized, it's a different number. And so that there is a formula that they build in saying 30% of people that are asymptomatic but test positive, are disease-free basically within X number of days. And so that formula is where they come up with it. We have the formula. I don't have it in front of me. We tried running the formula. The state reports that back every day to us, what our estimated active cases are, and we're relying on those epidemiologists now.
Yeah, I was going to say, if you showed me the formula, I wouldn't understand it. So, okay. And then the other thing, the last question I had, all this data, I guess with the exception of when it's pointed out, as far as I've seen, where it's pointed out that a lot of these, X number of cases came from one nursing home or came from a previously reported household. Beyond that, it seems like the data is at least as far as what's being published is pretty general. And so my question is, if you are and how you are able to use the data that we're getting from the state or that we were getting from the calls in Tyler to form strategies in terms of like preventative measures or messaging, and how we're able, I guess, to tailor that information that seems general to help our community.
Absolutely. So the best example I have is the nursing homes, and we started seeing, 1 or 2 or 3 cases pull up in a nursing home. We actually reached out to those nursing home administrators and made sure they had sufficient PPE, that their personnel didn't need any additional training, didn't need any additional equipment. And we have supplied lots of N95 respirators and lots of gowns and face shields and gloves to those nursing homes in our community. And so that's the best example. Their corporate supply chains got backed up because there were no nitrile gloves available in the country, and we had a cache of those, and we're able to immediately, and I mean like within 5 minutes, have them at their front door, trying to do that. So looking at those cases as we saw that happening, we made sure that we were reaching out to those partners. We did the same thing with Pilgrim's Pride, who's been a great partner throughout this entire event, but they tested hundreds and hundreds of employees. They allowed the state to come in and conduct those tests, and we're able to really stop this facility from having so many cases like a lot of other meat packing facilities across the country had. And so we are using that data. It's a little tougher when it's it's the neighbor down the block from you, and there's one person in a household. But we are trying to make sure that we're taking as much of that as we can, and really make sure that we get in there and get folks what they need. We also have the ability, if it's not something that we can locally provide, we also have those contacts with our state and federal partners that are pretty helpful at getting us that information or getting us that equipment that somebody needs. And so, does that answer?
Yes, and then it's sort of related. I mean, that answers how you, what you do to help remedy or improve in whatever way you can that situation. But in terms of guiding measures to help prevent in the future in this community. So say, for example, I mean, I understand that contact tracing is done, but that obviously that's not information that can be public, because then you're running into privacy concerns. And so, I mean, I understand that, and I understand why it has to be general, but I mean, in terms of like maybe where we're focusing messaging, or how we decide to distribute, or how we decide to post something on social media, or how we say it, more forward-looking strategies, I guess.
Absolutely. So Amy Mahaffey and Abby Scorsenelli at the county have done that, and will continue to do that. So they're taking a look at that case data, just like I am. And when they start seeing trends, let's say the population starts getting younger, they're trying to adapt the messaging for a younger population. So when our demographic starts moving down into the 18 to 29-year-olds, the messaging needs to be different than the 79 and older crowd. So we are doing that. And we're trying to make sure that we're crafting those messages effectively. We've asked the state on multiple occasions to allow us to do contact tracing locally, to provide us the information, and if they wanted to, the training. The county and city have both offered to put investigators on contact tracing, and the state has not been interested in having us take that on for them. We just thought that we could do it more quickly and more efficiently, and probably gather more useful data, but the Department of State Health Services wasn't interested. But the offer's still out there if they change their mind.
Okay, thank you, Chief. I appreciate it.
Okay, thank you, Amelia. Garth Hens.
Yes, thank you, Chief. I appreciate it. This is super thorough, and this has been really helpful. I'm curious, with our community partners, specifically SFA and then NISD, is there a way similar to the nursing homes that we can get relatively granular data when there is, say, an outbreak, God forbid, at Rigay or one of the other schools? Will that specificity and that granular level of data be put out there, or not so much?
So I'm hopeful that on September 8th, when we see the methodology that they're going to use for that, then we will. We'll have better visibility. So the daycare centers have to call us and report positive COVID cases now. And so the daycare centers have already taken that on. And so when a child at a daycare center or a staff member gets a positive test result, they are letting us know that. And so we're able to take a look at what's happening at a particular daycare center. So I'm hopeful that the school districts will be doing the same thing. I certainly will reach out to NISD and ask them if they would be willing to share that information with us, even if they're not required to by the state.
Would that be made publicly available, or is that something that we have obligation to keep privately?
So and in this COVID situation, a lot of this is kind of fluid. So if it's our data, we have more flexibility than if it's the state's data, for example. If it's the state's data to release, sometimes they're pretty particular about that. Obviously, we can't tell a student's name or the address they live. Sure. But certainly we could say it was a 7-year-old, or there's 5 people from a 2nd grade class. And so if we aggregated that data, just aggregated it a little bit, it would certainly pass HIPAA.
Awesome. That's fantastic. Okay. That's all I've got.
Okay, great. So, Chief, you asked about level of detail and anything additional. So I think it seems to me that your plan to going forward is a great one. I think there will be a lot less confusion. I hope that it's a time saver for you and for the county. And then as far as anything additional, so Amelia had asked for a positivity graph that included the surrounding area, state, and national, showing those numbers. And I think what Garth is requesting, at least for now, is an update on the TEA's plan once they release that on September 8th. So we'll know what we can expect to have reported. Did I get that right?
Absolutely. So I will report back on the Friday report. I will report back on our talks with the school district and give you an update on where we are with that information. And then again, before the meeting's over tonight, you should have a copy of the positivity chart.
And that will be something that will be ongoing, the positivity chart? Is that just not a one-time thing for tonight?
No, absolutely. So all the charts and graphs that you see and all the various reports that go out are things that we stumbled along and said, hey, we need a chart that explains this.
Right.
And so we sat down and built that chart, and then we kind of keep them going. That's a great one. It just wasn't one that we thought about, and Ms. Fisher outsmarted me once again.
At
Okay.
this point, I'm making a game out of it.
Okay. Does anyone have anything else they'd like to add? Yes, Mario.
Mayor, members of council, I had asked Chief Kiplinger to present this information. I know, obviously, with all the information coming out of his office and the county's office, there's always all kinds of questions that come up. And so what I've asked Chief is to, on a quarterly basis, unless things just drastically change, hopefully not for the worse, but things could happen, that on a quarterly basis he comes and he presents to council this level of information. Again, just to be able to, for you all to ask questions, for people in the community to go be able to watch, whether it's live streamed or the video at a future time at their convenience, so they can at least see what's going on and hear some of the questions that are being asked. And obviously that information will continue to be published, but it is just a way for Chief to have, he loves to have FaceTime in front of council, and to get some FaceTime in front of council so that you can all ask those questions. Because if you're asking those questions, others in the community have those same questions as well. And it's really good just to have those responses from one of our experts here in the community.
Great. Thank you so much. Okay, we are going to move to agenda item 5B, receive a report, hold a discussion, and give staff direction regarding the fiscal year 2020-2021 hotel fund and general fund budget projections and how it affects the operations of the Nacogdoches Convention and Visitors Bureau. And we're going to hear from Mario Canizares, our city manager, and Pam Curbo, our finance director.
All right, Mayor, members of council, Mario Canizares, your city manager. I left my office and went across the hall to do this presentation because it's a tag team with Pam Curbo. And so would like to go ahead and start that presentation and go through a number of slides. And then I'm going to hand it over to Pam to be able to talk through the financials. And then we also have Sherry from the CVB here to be able to answer any specifics you may have about some of the operating budgets. Just to make sure, is the presentation up?
Let me pull up.
Okay. All right, can you all see that?
Yes.
All right, great. Well, this is to get some direction from council on the budget, specifically regarding the general fund and the hotel motel fund, so that when when Pam comes to council over the coming next couple of weeks, we're starting to kind of wrap that budget up so that way we know which direction you want us to go, and we can present that information. So I'm going to go through a few slides so you can see. So here are the issues we're going to discuss. It's not a very lengthy presentation, but certainly it will garner a lot of discussion. Go over a little bit of the background of what's going on with the hotel fund, the approach and how we dealt with some of these issues and between city staff and the Convention and Visitors Bureau staff. We've got the financial discussion, the most important part, a recommendation that we are making and any next steps, and then certainly open it up for any Q&A from you all. So to give you a little bit of background, it's no secret that the hotel revenue, the hotel fund, the HOT fund revenues for what are being budgeted for next year are below expectations. We're experiencing those issues now. But what you'll see through the financial conversation that Pam will show, you'll see sort of the trend the last 3 years of what we've received on average in revenues, what the trend will be showing for next year, and then how we're looking at an outlook perspective. Normally, the city receives about $725,000, give or take, dollars of hotel revenues. This next year, we're expected to bring a little bit less than $500,000, under $500,000. So that's a 35% reduction in those normal expectations. If you look at the expenditures for the Convention and Visitors Bureau, approximately 2/3 of those expenditures are personnel related. The other third are comprised of administrative cost and marketing. And their marketing expenses do make up a large portion of the CVB budget beyond the personnel budget. And those are some of the areas that staff has been working with Convention and Visitors Bureau staff to be able to look at that component of the budget. The things that I'm hearing from colleagues around the state, and just the things that I've read on a national perspective, that the hotel industry should start seeing a full-blown pre-COVID recovery in 2023, 2024. Now, that doesn't mean that areas like Nacogdoches or other parts of the state or even other parts of the country might see a recovery sooner. That's just kind of the national narrative, is in that time frame where you start seeing kind of things get back to where they were prior to March of this year. As many of you know, funds of the hotel funds are restricted for those restricted for to put heads in beds and bring folks into the community, visitors, to be able to experience our community. So those are very restricted. As you know, the general fund, there's much more flexible. And as a result, because of that flexibility, it can basically be used for just about anything you would like for it to be used within reason. This is going to require a multi-year approach in looking at this, because it's going to require a subsidy based on where we find ourselves. So as we're approaching the issues, one of the things that I'd heard when I'd seen the presentation that Sherry had made a few weeks ago, that the council was very much, from what I could tell, a unanimous consent that the Convention and Visitors Bureau is a major component and that assists in the vibrancy of our local economy. They're there to greet our visitors, there to encourage people to go shop at our shops, at our restaurants, to just really experience and enjoy their time while they're here visiting in our community. The staff is small. It's comprised of a small employee team, interns and volunteers. So you know, they've got their nucleus of staff, and and they all do a really good job. And so we know that if we're going to look at the CVB budget, and based on how they're near and dear to what they do here in our community, we were trying to avoid looking at the employee side, but looking at some other expenses that are able to be reduced or looked at. Both city staff and CVB staff have been working the last few weeks really to scour through the budget, find opportunities where expenditures can be reduced. One of the goals is to maintain a semblance of our fund balances so that neither entity are negatively affected. And so that was one of my key goals. I also do believe that because there are hotel funds coming in, that those funds should be paying personnel expenses there at the organization and the majority of the marketing expenses. However, as I mentioned earlier, it will require a general fund subsidy. And the intent, as you'll see here shortly, that what we would cover through the general fund would be the health and dental insurance for the staff there, the administration cost. And again, this is an opportunity where by taking on those expenses, it allows both groups to work together to find some economies of scale and see if we can even reduce further those administrative costs, which in turn then would hopefully reduce the general fund subsidy. And then take on some of the marketing expenses. And really primarily marketing expenses we're talking about are some of the fees that they pay to their internet provider and for the website. So with that, before I turn it over to Pam, are there any questions that the council may have in relation to the slides that we've shown today? Or Mayor, would you rather wait till we get through the presentation and then open it up for questions at that point?
Well, I think it's easier to wait so we don't end up talking over each other unless you could raise your hand and wave if there's something sort of critical that needs further explanation. I don't see any. Okay.
Okay, so we can go ahead and proceed with the discussion. Okay, well, let me go ahead and turn it over to Pam and let her go on that piece.
Roll me back in. Mayor, council, I can't see y'all, but hey. So in front of you, well, let's see if you've got it yet. Hold on. For me.
Okay, it's there. We can see it now.
Okay, so this first slide is going to just basically show you some history of the hot funds and that particular set of revenues and expenditures. If you'll notice that, as Mario was saying earlier, we normally see about between $725 and $750 of tax receipts every year. And so for us to have proposed a budget of $472,000, we knew this was going to be a detrimental effect to the CVB. If you'll notice down at the bottom under the expense section, there is a line item called Tourist and Convention Services. That represents the 72.5% of the tax receipts that we send to the CVB. So back in 17-18, they received $532,000, followed the next year by $522,000, $525,000. As you'll notice in the proposed budget, it will be $342,000. And so there is where the rub comes in. Sherry's done a very good job of trying to prepare a budget, but when you reduce the revenues by $183,000, it becomes very difficult to maintain the budget as it was. And so that is what kind of was the impetus of us having these discussions and trying to come up with a plan to keep the CVB operating at the level that we all want them to and still work within this COVID timeframe. If you'll go ahead and jump to the next one. Now, this next section is basically looking forward. Now, these are all very just guesses on my part. We've taken the fact that the industry says that we will be back whole by 23, 24, and so basically, I just have taken over the next couple of years and realized that we will have some sort of increase each year until we get whole again. And so those revenues are just guesses. Shows next year's future budget at 550, followed by 625, and then back to the 750. That was the pre-COVID the pre-COVID amount. And so these, of course, will change from year to year. What we will be doing every year going forward for this is we will be presenting y'all a future budget. And so these will be updated as we go. But based on these assumptions, you'll see down there the tourist and convention services line item will increase somewhat every year because this is basically based on that 72.5%. And then at the bottom, you will notice this is where the city subsidy comes in. And so that's what we're proposing tonight, is for the city to take over and cover the employee health and dental insurance, which is $25,200. The administrative cost of the CVB, which is $62,670. That is a reduction from their prior year administrative cost, and we have some detail on that. But they have cut their line item budgets. We will be proposing that we cover all administrative costs, and then the marketing expenses that we will cover are, like Mario said, is going to be the website, and I think they have an app that they use. And so those are the things that make up the $109,000 of the subsidy that we're proposing. Now, as you see, we're going forward, as revenues increase, so does their payment to the CVB, and then the city subsidy will be reduced each year accordingly. So as they get back on their feet, we'll be able to reduce this each year, and hopefully by 23, 24, everything is back to normal and the subsidy goes away. You want that? Okay. All right. So this is hard to go back and forth in here. So basically, of course, the staff recommendation is that the general fund does subsidize the CVB in the amount of $109,870 for the 2021 budget year. Now, this is a grant. It's not a loan. We are not deferring any of the CVB's payments here. This definitely is just going to be a real subsidy that the CVB is not encumbered upon to reimburse the general fund for. Also to note, Sherry will be presenting the CVB budget in more detail to City Council on the 8th of September. Now, you will see their budget, and Sherry and I and their accountant will be meeting later this week to kind of get it in line so that our budget looks a little bit, what you've seen tonight looks more like what you're going to see. But keep in mind that some of our expenses, like we currently, the CVB is on our electric plan. So we pay those electric bills, and currently we bill them and they reimburse us. Well, we'll stop billing them. We're going to continue paying them, but they won't be an expense for the CVB anymore. So those line items will basically come out of the CVB's budget. And so at the end of the day, the amounts are the same. The way they're reflected on their budget is going to be a little bit different. But we'll make sure that it's all very, very detailed, and so that y'all can see those differences. And of course, remember that the city budget adoption will be on September the 15th. In order for us to do this, we will definitely need some guidance on this tonight to know how to build that budget for you, so that when we bring that to you for adoption on the 15th, that we actually have a good budget in front of us. And with that, we will open up for questions and answers, and I will let Mario come back.
Okay. Thank you so much, Pam. Let's start with Jay Anderson this time.
I had two quick questions. First, the line items which the city would be covering, specifically Pam mentioned electrical service for the CVB. Will that be, is that proposed to be a permanent change, or is that a temporary change until the hot tax gets back to the point that it should be?
I think the way Pam has explained it to me, that it will basically continue the way it's always been. It's just that we're just not expecting a reimbursement from the CDB. So it basically just won't show as an expense on their budget. It'll just be an expense on our city. So really, at the end of the day, it's just one less of an accounting maneuver that needs to.
Okay, so there's really no fundamental change in exchange of funds there.
Correct.
Okay, gotcha. My other question is there any particular part of the city's budget which from which the funds proposed to subsidize the CVB will be coming? Basically my question is there any city service or area that's going to suffer in any way for that?
No, sir, not at all. In fact,
Okay.
Because there is already a budget of the CDB component in the city's budget.
Right.
It'll just it'll just show as an expenditure, but there will be no reimbursement. So no one's being negatively affected by this recommendation.
Okay, perfect. Thank you very much.
You're welcome.
Okay, Amelia Fisher.
So you guys bear with me if I'm asking the same question that Jay just asked, but it sounded like I was, and then I wasn't so sure. So my question is, I'm assuming that in our city budget, we didn't just have $109,000 just like laying around, and where it's coming from. Is it coming from the money that we're saving and not filling certain positions, or in other cost-cutting things that every single department has been asked to take on?
Well, no. If you recall, at the last meeting, there was a discussion about potential doing a tax increase. And so that is a portion of where that would come from. So probably about a third of what that tax increase would have generated would obviously be directed towards the CDB budget. So it is not intended to reduce the fund balance of the general fund, or to take monies away from anything about future dollars that would be coming in through the appraisals calculated with the tax rate.
Is that, thank you. Is that something that is the CVB subsidy something that was taken into account at that time when staff was reviewing whether to do the tax rate increase?
Not really, no ma'am. When I started on August the 10th, I was asked to work with the Convention and Visitors Bureau because they had come to council a couple of weeks prior, and they had mentioned their concerns about the revenues. And so it was requested of me to go and work with them to try to find solutions. And so, I mean, it really, quite honestly, it was fortunate that you all have trusted staff on the recommendations for the tax rate, and we had that capacity. And so it is through good financial stewardship of being able to hold expenses down a little bit better than expected revenues on the sales tax as things progress, that we were able to find that flexibility to do so.
Thank you.
You're welcome.
Okay, Mr. Hands.
Thanks. I like the projections. I like the stair-step approach that we're getting them back on their feet and making sure that we can preserve the staff as much as we can. I'm curious, you mentioned some of the administrative costs and opportunity to potentially capitalize on some economies of scale there. Would you mind touching on where there might be some of those opportunities? It's not like the electrical you already talked about. It's already something that's being covered. It's not going to be reimbursed. But are there some opportunities there that you can see?
I do, and maybe Sherry could, she's on the line. She might be able to elaborate just because she's sharing a little bit. But there could be opportunities where, just even on building maintenance, if there are issues that need to be maintained or need to be repaired, they're at their facility. If there's an opportunity to utilize some of our existing vendors, that we may be able to get better rate or better response, or even our own staff that may be able to go over there and look and see if there's some things that could be done from a minor perspective that could be done in-house. If we can find those means to not have to call out someone else, then there may be even if it's just being able to find minor economies of scale, that is just one less dollar being spent from that general fund subsidy is what we're looking at.
Absolutely. I wasn't necessarily asking for you guys to get in the weeds. I didn't mean to put that on you on the spot.
Okay.
Just certainly, I appreciate that intentionality. There's, to your point, every dollar saved helps. So I appreciate that.
Well, and they elaborate again as we find these, and we'll find these more as we have more experience working closely with Sherry and her team. As we find those economies, if we can get better rates or better utilization of existing contracts through our own vendors, or just relooking at things, every dollar saved through that administrative cost is one less dollar spent in the general fund.
Absolutely. Thank you.
You're welcome.
Okay, and Mr. Bolden.
Thank you, Mayor. City Manager Mario,
Yes, sir.
I'm glad it was, I have an understanding now that the tax rate increase proposal was not part of the budget, the $109,000 as it stands today, because that makes a big difference in the way I think about this. But I really have an issue with the amount of expense towards personnel versus administrative duties, because the administrative duties, if you cut their budget, it's nil compared to what we are spending with personnel. I'm not sure how many employees we have at CVB, whether they full-time or part-time, which would make a difference in what expertise field they are. They all in expertise fields. But I would like to see CVB and the city, it's all one group anyway, but become co-partners. If there is employees, because from my understanding, we have 6 spots that we are not going to fill for this budget year. If some of those employees could work in that area, and also I sort of have a feeling that there are some, well, she probably won't like this, but I won't say it anyway, like the city secretary. She has a workload. Surely some of those, one of those at the CVB could, I mean, she does reports, she does phone calls, she takes all the crazy phone calls from the, citizens and she takes a lot of unnecessary calls from city council members, et cetera. That could be at least one person until things are better at the CVB. We could partner together with some of the employees at CVB and put them in positions at the city, and we wouldn't have to be transferring funds, especially if we're going to ask for a tax rate increase. Do you have a comment on that?
Sir, I'm sorry, could you repeat that last
Can
piece?
you comment on that?
Oh, sure, absolutely. Again, certainly Sherry's on the line and she can elaborate on her staffing levels. But I absolutely do completely agree, sir. One of the things that Sherry and I have chatted over the last few weeks is, again, certainly want to make sure that her folks are fine and taken care of, and that there's no concerns, because it is anxious but along the way, if by chance there is a vacancy there at the Convention and Visitors Bureau, one of the things I would ask of Sherry, and again, it's her call because it's their operation, but they hold that vacancy and not refill it. Doesn't mean that you don't refill it forever, but maybe you just don't refill it for the time being, so that allows the hotel fund to kind of cover more of those administrative costs that the general fund shouldn't, because the revenues would be coming in. On the flip side of that, if we have opportunities here at the city, if someone leaves, or if there's opportunities now where we need marketing assistance, or in some other capacity, I certainly don't mind at all reaching out to Sherry and seeing if there's a way that some of her staff can maybe help fill that gap, so that we're not having to go and immediately go replace that individual that may leave the organization. And again, it's all about trying to find ways to continue to collaborate, share resources. Again, as you mentioned, we're all one. We're here to do one thing, and that is serve our community. So I absolutely believe there are ways in which we can do things differently as needed. And again,
Thank you.
Sherry's on the line if she would like to expand on the number of staff, but she'll go into greater detail next Tuesday about the expenses and her approach to marketing and her approach on just some of the other operations there at the Bureau.
Sure. I'd like to point out that in this presentation, personnel costs, aside from what the part of the subsidy is for our employees, is for the insurance benefits, but the wages we would still be paying out of our budget. We do have 4 full-time staff, and then we have 1 part-time, and that's our part-time is our accountant. And it's not necessarily that we're all siloed, but our main purpose is promotions and marketing. So we have Mike Bay, who covers our volunteers that help us keep open on the weekend, and then he oversees all of guest relations. And so he's sort of the face of our organization. And then we have a sales staff of 1, Joanna Temple, who does our sales and promotions. And then we have a creative content director, Ashley Morgan, who anything that any of us need, if Mike needs a creative brochure made or a map made, then that falls on Ashley. So Ashley is sort of intertwined into all of our duties as well. But for guest services, I'm the one that knows how to bulk print name tags and merge an Excel spreadsheet. So when we were having groups in, we all kind of jump in and help where our skill set is, even if it's outside of our technical job description. And absolutely, we stand at the ready to assist in any way that we can. We are contracted employees of the city. That's part of our contract with the city. And we're happy to do that. And, my hope is that where we can help the underlying rationale behind that, on top of saving money, but is really to consolidate efforts and not duplicate efforts. So, Nedco and Larissa, they market Nacogdoches. We market Nacogdoches. We're marketing the same product, but we're marketing it to different audiences and for different purposes. And one way that we found to reduce our marketing budget is to reduce our number of print insertions in Texas highways, increase our Texas Monthly full page ad, and then co-op the payment of that so that we can have we have a knack for that full page ad in a prestigious publication like Texas Monthly, but its services bringing industry in, as well as visitors, as well as new residents. And so there's not a duplication of effort between the economic development staff and our staff. So in our mindset, that's where we have found ways to cut the budget. But I think if there is an organic crossover where our staff can assist Jan in answering phone calls, we're answering phone calls all day as well. So we could certainly help lessen the burden on Jan in that sense. And if Amy as communications director or any department anywhere would need marketing assistance or creative content creation, then we can assist there.
Yeah, I said Jan, but it could have been anywhere.
Sure.
As far as marketing, are we going to focus differently as to the groups, the potential visitors to Nacogdoches? I mean, are we going to go like a younger age group, et cetera? Are we changing that?
Yes, sir. We typically, our target audience is that newly retired age brackets. And what we've learned in this time, these are unprecedented. I don't know that, that probably has only been said 5 times. So nobody really knows what to get out of all of this. But the travel and tourism hospitality industry pays to do these travel sentiment surveys. And these surveys are providing us on the spot, in the minute information about what messaging is striking well with different demographics and what demographics are traveling. and their feelings around that. So we know that our typical target audience does not feel safe still traveling, and they won't until there's a vaccine in place. And when they do travel, they want to travel to destinations where the residential population of that town are practicing best practices in safety and they're in compliance with mask ordinances. They want the reassurance, the physical, tangible reassurance of safety in that community before they choose to come in. And in those same travel sentiment surveys, we know that there is this newly emerging group that typically has not been in our target audience range, and that's the millennial and the Gen Z market. They're more adventuresome. They are not so fearsome. They are willing to travel. They're capitalizing on the great travel deals there are now to Cancun. They're not afraid to fly. And just inherently to that lifestyle, they do travel on a whim. So if they hear that there's zip lining in Nacogdoches and you can tandem zip line under a canopy of historic pines, they're going to pack their bags and get in their car and come to Nacogdoches and stay for a day. And if they like it, they'll stay for 2 days. That's just the profile of that traveler. So we're able now to adjust our message and still hold a place for our traditional target and let them know that when they do feel safe, that we're here for them, but we can also sort of broaden our scope in finding audiences to target and include that younger demographic. And for example, our micro campaign to include that younger demographic, I mentioned in my last presentation, we call it making hipstery. And so we take Red House Winery, which is an asset that's very popular to that younger demographic, and we explain the history behind that destination. Why is it called the Red House Winery? And what relevance is that to Nacogdoches and that sort of thing? So, we're trying to reintroduce Nacogdoches as a historic destination to this younger demographic and kind of sneak it in. It's kind of like grinding up zucchini and putting it in the spaghetti sauce so you can get some vegetables in your kid, but on a much more professional marketing level.
Thank you very much.
Okay. I think this is a very impressive idea. Overall, the CVB is a vital part of our city, and the impressive part is finding a way to help them with their funding. I really like the form of a grant. I'm very grateful that you all were able to find that money so that we didn't have to go into reserves, which was a consideration. And then I think the only direction is actually from Mr. Bolden. And if I understand him correctly, that would be just to continue to collaborate between the CVB and the city. I think it would be awesome for the city to take it, or any department or employee to take advantage of their talents and their skills if they are available during this time. Is that correct, Mr. Bolden?
Yes, ma'am.
Okay. Does anyone want to add anything else?
I had one last thing. I wanted to officially and on the record express my sincere gratitude and thanks. This is far more than a job for our staff. We take it very seriously, and it's been tumultuous, and it's hard not knowing what the next day is going to bring. But we have made it our goal to face each day with a smile and with optimism, and to never compromise the quality of the service that we provide to Nacogdoches. And I appreciate and value your leadership and even entertaining the thought to invest in us and place even more trust in us than you already do. So thank you.
Thank you, Sherry. You are greatly appreciated, and so is your staff. Okay, let us move forward to agenda item 5C. Receive a report, hold a discussion, and give staff direction regarding CARES Act Coronavirus Relief Fund spending. And we will be, I guess we have a tag team again with Larissa Philpott and Pam Kerbo.
I was out of order. I didn't know I was going first. Okay, so are we up? Let's see. Hold on just a second. And y'all bear with me because I know this is this is extremely confusing for all of us. So if you have any questions, please stop and ask me, because this is going to, all these percentages and numbers are going to be confusing. All right, there we go. So I know you're all aware that several months ago, the federal government has taken many steps in order to help citizens and local governments, state governments, try to work through the economic impact of the COVID-19 virus. One of the things that are available to the local government through the CARES Act is some particular funding that flows through the state. The state has imposed a handful of restrictions on that money that kind of, I don't want to say handicaps us, but it does a little bit. If you go ahead and jump over one. Basically what they did is they assigned an amount to each entity, local governments, counties, and cities based on a population. I believe it was $55 per citizen per capita in the population. The city of Nacogdoches' share of that money is $1.85 million. Okay. That's what is available to us through the CARES Act. The state then set two boundaries on that. So there are basically two pots of money. And I don't know if y'all will recall several council meetings ago, I think sometime in July, maybe June, y'all authorized us to actually apply for the first 20% allocation. And so that $370,000 has been received by the city. Now, with that 20%, there are some restrictions on how we can spend that. That money is split into two pieces. 75% or $277,000 can be spent on response. That can be PPE, employee overtime, anything that we have spent to protect the public, to protect the city, cost of masks, cost of hand sanitizer. Those are the types of things that are covered under that 75% response. Now we'll go over in detail in a little bit some items that we are looking to purchase with that money, and so we'll cover those. But the other portion of that first allocation, there is money set aside, 25%, for economic stimulus, and that is for the cities to push out into the community. And so with this first allocation, we have $92,000 available. Now, what Larissa is going to go over in a few minutes is how we plan to push that stimulus to our local businesses. Now, we still have a December 30th deadline to spend all of this money, the whole $1.8 million. We have yet to spend our first 20%. We're getting there, and I think probably if the fire chief and I can sit down this week and finalize a couple of purchases, we will get there. And in so doing, we will be coming back to you on probably the 15th of September, asking you to let us request the additional $1.4 million in the 80% allocation. So hopefully that is coming soon. We cannot request that until we have spent the full $370,000. So that's why it's kind of important for us tonight to finalize the plans for this 25% economic stimulus so that we can push that out to the public and open up our second pot of money. Now, on that second pot of money, you'll notice that 75% of that still is for response, which is $1.1 million, and then another 25% for economic stimulus, which calculates to the $370,000. So approximately to date, we have spent about $100,000. Now that is a very rough estimate because we have not calculated all of the overtime from the very, very beginning. The state has changed the rules on us a little bit as we've gone. And so we've found out that some of the time from March and April that we did not include, we're going to be able to apply to this. So we are still working on these numbers, but so far we've done some plexiglass partitions in our customer service areas. We bought chemical foggers, face masks. Of course, we did have overtime during the very beginning, and then emergency sick time for any of our employees that either tested positive or had to be quarantined pending test. And so all of that is going to be reimbursable through this first set of money. Now we also, this is the big set of money that we're going to try to finish out as soon as possible so that we can open up the second allocation. And that's going to be some Wi-Fi hotspots for parks and downtown. I believe that we're to the point we've got that almost ready to roll. We're doing hand washing stations downtown. We're going to buy additional laptops for city staff to work remotely if and when we have to go back to a remote work site later on. And then, of course, the big item down there is the fire department, an additional set of turnout gear. And this one was very important for us to get approval on. Our firemen have one set of gear. And so if they go to a COVID call and they're basically contaminated, they do not have a second set of gear. So if they get called out again, they have gear that has not been cleaned. And so the state said, yes, that was definitely something that we could pursue. And so the fire chief and I are going to work on getting that done as quickly as possible. Go ahead if you don't mind. Oh, we're going to switch real quick.
So I am going to tag back in here for a moment to talk about this economic stimulus program. And this is something that this is not unique to Nacogdoches. This has been done all over the state. The city of Lufkin did a very similar program. So what we are presenting to you today, we will be totally honest and say we have most of these regulations and then program design, we utilize the framework from other cities, which is a good thing. Just a little bit of a note, traditionally when I bring you incentive packages, we ask for tax rebates and large infrastructure investments. And that's not really helpful to our very smallest of businesses. Some of those businesses that aren't even operating aren't generating tax revenue today, so we don't have anything to rebate back to them. So this would be a grant, which is something that Nacogdoches has not ever been able to do because we didn't have a funding source. And so now, thankfully, through the CARES Act, we have a funding source to be able to do that. Just a little bit before we dive in, the objectives and the reason why we're doing this. And please, while I'm going through this list, please let me know if there's one that takes a priority for you. And if so, then we can maybe tweak the program to make sure that we support that priority, and then also so that we're measuring the outcomes appropriately to make sure that we address that priority. So the program is designed to preserve jobs, to keep businesses open, to support our downtown and other tourist-related industry that is really hurting right now and has really been more negatively affected by this. Facilitating compliance with public health recommendations so that we continue to keep our count low. If our businesses can do all the things that the city's been able to do as far as installing new partitions and training staff and buying PPE, then that helps our public health. And then also sustaining our tax base so our city can continue to provide services. We've been very lucky that our sales tax has had some really good months. But we want to make sure that we keep these businesses open through the fall for a very long time so that we can continue that good trend on sales tax. So just to explain the program a little bit, the businesses, we're proposing an 80-20 split between nonprofits and for-profit businesses. That way we're not taking a nonprofit with maybe a really good story and competing it with a small business. Or we're not trying to put a for-profit business up against a nonprofit. They're both in their own separate categories. They do have to be located within the city of Nacogdoches. We capped the size at less than 300 employees so that it is truly geared towards our smaller businesses. They must show evidence of a closure due to an executive order or show a negative financial impact. So we want to make sure that this is truly going to the businesses that need it. It does need to be an independent business, and that means not a national chain big box store. The funding, as you can see kind of in the middle of the slide, is based on business size up to $10,000. They must use the money for COVID response and recovery. So let's say a business just in their business plan has said, we really want a second location and we want to open that up today, and we're going to use this money to open a second location. It's not necessarily, that's not really what this is geared toward. This is to be paid for health supplies, inventory, response to COVID with PPE, maybe some of the things we talked about with the city. Maybe you need to buy laptops and things like that for your business to operate safely. We will require financial information about the operation. I have asked a couple of bankers that I work with closely to review the guidelines, and they suggested that we request the businesses to provide both a profit and loss sheet as well as a balance sheet so that we can see have a good picture of what has happened over the last couple of months and really what their cash operations look like today. The committee will review these applications. We will ask the banks in town to provide us with a couple of representatives to help review these applications. We expect we'll have quite a lot, and I didn't want to hand Pam and her crew just a huge stack of paperwork. So that committee will review the first batch and then make a first review and then send it on to finance for a final approval. The applications will be funded on a first come, first completed, first served basis. So if you have an incomplete application, we'll notify you, ask you to complete it. But the folks that have their complete applications will be reviewed first. And with that, let me talk about reporting really fast. So we will ask for a report within 6 months that shows that they, how they use the funds, that they're still open, and the number of employees that they have. We also will, the great thing about this program is it allows us kind of an in to connect with some of our very, very small businesses that we traditionally don't have a lot of contact with. And it will let us kind of connect them with mentors if that's necessary. NEDCO has a great mentorship program and an entrepreneurship program, really. And so this is a way to connect those two and ensure that the city's return on investment is a stronger business at the end of the day. It's not just cash into these businesses. We're going to hopefully strengthen the businesses. I'm going to turn it back over to Pam, and then I will be back for question and answer later.
Feel like I'm in elementary school again. Okay, so this next slide is basically the same thing that we talked about earlier with a little more detail now that Larissa has expanded on the economic stimulus. So you'll see here with the 25% of the stimulus money on the first round of $92,000 will be split based on the 90-10 split for small businesses and nonprofits. What is interesting on the second tranche of money is that this opens up $370,000 for economic stimulus for the community. And of that, we have received a request from NISD to apply for a match for their technology that basically the TEA has reached out to all the ISDs in the state and said, you know, please contact your local governments. And we have a program now that if your local governments will use their CARES funding to match the technology purchase up to 10%, we will increase our match another 10%. And so what this does for the NISD here is our $152,000 basically becomes, you know, $304,000 for the school district, because the TEA is going to pitch in that equal amount for them. And so that request is on the table. We have discussed this with NISD, that is something that we would be looking at funding if we are able complete the expenditure of the first 20% and bring in the second tranche, then that would be something that we would definitely bring to the table for the NISD. That would leave $218,000 of remaining stimulus money, still with a 90-10 split between small businesses and nonprofits. And I believe what we will do is during the process on the first set of stimulus, if anyone is first come, first completed, first served, once that $92,000 is exhausted, those applications will be held pending the ability for us to pull down that 370, and then maybe we'll have more businesses that maybe were not approved the first time, that they'll be able to basically their application will roll over. So we're hopeful that we're able to get to that point. Again, December the 30th is the deadline on all of this. So timing really is of the essence right now. And so that's basically what we're fighting against. With the second tranche of money on the response side, we have a handful of things that we're looking at. And of course, I believe, let me go back and tell you that's like another $1.1 million that are available. At this point, we do not have expenditures that we anticipate being close to that. But here's a couple of the items that we are thinking about. We may buy a couple of chemical foggers, any emergency sick time and overtime as we go through the fall. We just don't know how many of our employees could be impacted and have test positive or have to quarantine. And so we've set aside some money to cover that. The extractors for the bunker gear for the firefighters, these are basically the machines that wash, I guess. I don't know. Keith will probably laugh at me, but this is the bunker gear washers. So that is something that we're looking if we pull down more money. And then we are in the process right now. Army Curtis is working on a space plan for City Hall for us, basically to look at for the time being. The first part of this is to look at the council chambers and see what we need to do to make that the spatial. Right now, of course, we can't fit y'all all in there and maintain social distancing. So he's drawing up some plans on how to utilize the first floor better and safely. So part of that is right now we just don't have a clue what the amount would be the potential repositioning of the council chambers. And so based on that plan, we will have some ideas. Right now, we just don't know exactly how much that's going to cost and if we're going to have time to do it before December the 30th. So this next slide is basically just a little bit of the view for NISD's request. And it basically shows that NISD has spent, and they've already made this purchase, their own order for computers, iPads, and Chromebooks for the district of a little over $1.5 million. TEA has given them a match on that already of $761,000. What they've asked from us is a 10% match of $152,000. Once we are able to do that, then the TEA will give them another $152,000. So at the end of the day, NISD's cost will be $456,000 for $1.5 million worth of computers, iPads, and Chromebooks. I think that may be the last one. So this one is this request I think is extremely important for the district, and I think at first we were kind of, why are we even in this? Why is the city and county? And then we had a very good conversation with their CFO, and it made really good sense at the end of the day. And so I know that we've already put in the Wi-Fi spot so that the students can go to the parks, the pavilions, and do their homework there. This just allows us to be a good neighbor. And if we're able to get into that next set of funding, then we can really look at this request, and we'll be coming back to you for that as well, I'm sure. But this is very important for NISD, so we wanted to make sure that y'all are aware of this early. That's it. Let's jump on the other side. I'll do what? Go ahead, one more. Oh, okay.
So tonight, we are asking you to give some direction to us regarding the proposed spending that Pam went over, the things that the city hasn't pulled the trigger on yet. The program design for the small business, the economic stimulus program. If you give us support for that tonight, we will move forward with both of those and only come back to you with items that require council action for purchase, which is over 50, which is anything over 50,000. And then also each one of the recipients of the economic stimulus grant would be entered into a Chapter 380 agreement, which you would, of course, approve just like any other Chapter 380 agreement we might do for a typical business incentive. And with that, I will turn it back over to the mayor. Thank you.
Thank you very much. Okay, that's a lot of information. Let's start with Ms. Fisher.
I was going to say I'm ready, but then I couldn't click to unmute myself. Okay. I have a couple of questions. I think I have one for Larissa and one for Pam. But first off, I want to say I think that the decision to entertain and to propose to us helping out with the TEA match program and helping out NISD is a very worthy cause. I mean, it to me, the way that I look at it is, you know, we're not helping out, even though we are helping out another institution. These are our kids and the future of Nacogdoches. And so it makes perfect sense why we would care about that and want to use some of that money toward that. So I'm glad that is included in part of the programming. Larissa, since your face is there, I will ask your question first. So on the stimulus to local businesses, I heard you say, you know, we want to focus on helping out our smaller businesses, which I totally am all for. And then the downtown, which is sort of the life of the community. I think given that comment, and then also that it's a first come, first serve basis, I would like to just ask that in the rolling out of, and I'm sure you've thought of this, but in the rolling out of this program, and particularly of letting businesses in the community know that this is an opportunity for them, that it be kept in mind, sort of that the information is being distributed in an equitable way. So while I agree with you that our downtown is important and vibrant and attracts people, that is not to the exclusion of the importance and vitality of South Side restaurants, for example. And so I would just expect, and I know that it's something that you thought about, but that distribution of information is being done on an equitable level.
Absolutely. And I appreciate that comment because it brings up something that I wanted to mention. And I'm grateful for my finance committee, the committee of bankers that have stepped up and said that they would love to help because they've processed the P3 loans. And so they've kind of been through this, and they're also such a great lifeline to our small businesses across the community. And I'm just going to call one of them out, Bancorp South on South Street. I know supports a lot of the small businesses on South Street, for example. And so we can connect with the bankers in each one of our major banks in town to make sure that they are reaching those communities that don't always get this message.
Yeah, and I think for some of those businesses, the messaging obviously would have to be different than for downtown stuff. You know, I mean, particularly given that you know, we have a lot of businesses down that way that are immigrant run, and so sort of the distrust, which I know we're going to discuss in the census item later, but that distrust of why is somebody from the government giving me money and not asking for it back. So yeah, I appreciate that consideration. And then, were you going to say something? Sorry.
Oh, I was just going to say one. I know that there will be things after we do this first round of funding. I know we will probably find out things that we need to fix. And so I'm looking at it as kind of a phase 1 and phase 2 approach, that we'll have this first phase of small business funding, and we'll maybe come back after this first phase and go, you know what, I'm not sure that this requirement was helpful, or we need to add this requirement, or maybe we need to connect with somebody in the community that can help these businesses meet this requirement. And so I'm sure we'll come back with that. So I'm grateful, honestly, for the 2 phases.
Awesome. And I also think it's a really great foot forward for NEDCO that is, trying to break into these other kinds of business communities that maybe have been reluctant to be involved in some of your other programs. So that's great. And then I have a question for Pam. Hey, there you are. In the using the money for personal protective equipment, has there been any thought to buying up just like a bulk of masks that we can have on hand at City Hall or at some place that is easily accessible for the public?
I don't know if Keith is still on the call, but he has assured us that we have tons of PPE on site. I don't really know what tons is, but when we were talking about buying more, he's like, we have got plenty of this, this, and this. So if he's here, he can jump in. If not, I will sure let you know what that inventory is as a later date. But yes, we have supposedly have plenty of PPE. So
I see the chief's face.
Yeah.
So we do have plenty for our first responders and for our healthcare providers, but we do not have provisions for the general public. So if you wanted us to consider looking at maybe some reusable masks that we could give to the public with a stay safe message on them or something like that, I think that would be wholly appropriate. We bought some for city staff that were very, very reasonable in price, and I think we could maybe modify the message and do some messaging on those masks, and that certainly would be an eligible expense, I think.
Cool. And I mean, I think, don't mistake what I'm saying, but I think that everything that you guys mentioned about what you could use the money for is certainly worthy. And so it's just something that I had thought about whether it could help in encouraging people to wear them if they were made publicly available. And that's all.
Yeah, no, that's a good idea.
Okay, thank you. Mr. Hens.
There we go. So just trying to anticipate some of the bottlenecks on the back end. One of the things that we looked at there on the second tranche is the design and then potential reallocation of the space for the city council chambers, which, certainly we haven't discussed this before, not in my tenure anyway, but it is relatively small. There's not a whole lot of people, certainly citizens that can come in there. So I think that's something that is absolutely worth looking at. With the funds, for them to be considered allocated, do they have to be actually spent? So we'd have to make it all the way through the first tranche, design it, and actually get the construction done and paid for?
Yes, and that is kind of the problem right now. Is, like I said, time is really, really crazy now. We have not received any word that date will change, but y'all understand how the federal government has gone through this entire process. It is it's a possibility, but we can't work under that possibility. We have to stay with the December 30th deadline right now. One thing that the state did inform us is, if you're going to do this space plan, then y'all have to commit to doing something. And so at the very minimum, we would probably, I think Army has discussed with us a little bit, we would at the very least redo the seating area. And so there are things that he's going to bring to us, different levels of things that we can accomplish, on the short term and then on the long term. And if for some reason the date is changed, then we'll be able to go that route as well. But we will do something before December the 30th.
Awesome. And is there a specific timeline that's given to us, or is it as soon as we spend the tranche 1, then it kicks into the tranche 2?
Well, that is one thing that, we will come to y'all, and I'm hopeful by September the 15th, we have proved up that we have got the first set allocated, because I'm gonna have to find out, but I don't think we have to actually have spent the entire first tranche before we request the second one. If that's the case, then we're probably going to ask for y'all to allow us to pull down that second tranche in September.
Awesome.
If at all possible.
Thank you.
Uh-huh.
Okay, Mr. Bolden.
Mayor, just casual question on the. I'm not sure what the timeline was of the CRF funds, but since we only had one set of gear for the turnout gear, my question would be, why was that not a priority in the first bunch of money?
Well, it is going to be part of the first bunch of money. Honestly, that is something that, and I don't know, we've just been racking our brains on everything that we could come up with that would be a expense. And I don't remember if it was Larissa or Keith one, but came up with that idea and said, check with the state and see if this is a possibility. And so the entire staff, all of the executive staff and the managers have been just really trying to come up with ideas of how to utilize these funds. And so that was an idea. Like I said, I'm not sure if it was Larissa or Keith, but that's something that just came up in the last few weeks that we decided. And Larissa can speak to more of that.
And I'll just add that unfortunately, this has been a kind of continually moving target. And we've seen other cities say, well, we're doing X, and then we will contact the state, and the state says, absolutely, they are not going to get reimbursed for that. And so we've had things that were of a higher priority, as if you can imagine that. But then the state came back and said, we're not going to approve that in an audit later, and the city would be held responsible for those monies. So things have continually moved on and off this list as we've gotten answers from the state.
Okay, thank you. On the proposed to NISD, the 152,000, is that the top that we could propose, or is that just what we decided to do?
We believe that is the total amount that we are allowed to give. That is what the request from NISD was. They sent us a couple of examples.
Mm-hmm.
The highest example was a 10% match.
Do you know if the county matched that also?
The county technically has the ability to do the same program. However, the county is responsible for the county jail, and they have significantly more expenses for response. You could technically spend 100% of your CARES Act money on response, and the county may very well end up doing that. I don't want to cite any specific numbers about their budget, but I know that they are spending quite a bit of money in testing and supplies and overtime, because just like every other jail in the state, they've had some cases out there.
Okay, I'm just, this is not a question, but on nonprofits, 501c3s, if your primary goal is like food and for citizens of the city, or if you have a primary goal of scholarships for children, is that included in that?
I believe it would be, as long as you, as the nonprofit is a registered 501c3 nonprofit in the city of Nacogdoches. I feel like those would both qualify. That is we can certainly add some additional regulations. We can limit the types of nonprofits, anything the council would like.
Yeah, because a lot of the nonprofits, and I'm a member of a couple of them, is the events that raise money to support the nonprofit administrative and sometimes personnel.
Mm-hmm.
That avenue is no longer there.
Exactly. And that's why it was important to us. And this was a discussion with the mayor early on, that we give the nonprofit their own set aside, so that we can kind of protect that set aside, and then also give the businesses their own set aside.
Thank you very much.
Thank you.
Okay. Mr. Anderson.
Yes, thank you, Madam Mayor. I had two quick questions for Ms. Philpott. And they're kind of dovetailing off of Ms. Fisher's question about the sort of equitable distribution of the economic stimulus monies. I guess primarily, is there going to be a mechanism in place for disseminating information about that availability? Because you mentioned specifically the South Street branch of Bancorp South. In normal times, that would be a place where a lot of those Southside business owners would be visiting on a regular basis. They can't do that now. So that would be a normal sort of point of putting some printed materials out or something like that. But we don't have that option right now. Is there some other way that y'all have in mind to kind of get the word out that those monies will be available and that applications will be available?
Sure. We are lucky in that one of the positive things about the situation with COVID is that the city's social media following has increased exponentially. And so a lot of information will be pushed out that way, in addition to our traditional media contacts. KTRE and the Daily Sentinel are fabulous about running stories that we ask them to run. Touching back on the bank part, our banks became so intimately familiar with the businesses that need help through the PPP loan process. And so a lot of them can contact businesses directly. And then just make sure that they're reaching out. We've got such a great small banking community here in Nacogdoches that a lot of those bankers know folks that may be interested, whether or not they did receive a P3 loan, but they can reach out directly to their customers and let them know that it's available. Okay, great.
And my other question is as much out of curiosity as anything, will applications for those stimulus funds from small businesses go through you, or will they go directly to the bankers who will be reviewing them?
They will go through, and one of our IT folks is sitting right next to me. So if you see something fly across the screen and they haven't heard it yet, we're hopefully going to have it online on the city's website. And so we will process those we'll download those applications essentially, and then process them through our bankers. So they will come directly to the city, and then we will provide them to the banking community.
Okay, great. Thank you very much.
Okay, great. So it sounds like the only direction that I heard was from Amelia Fisher, and that was to look at a provision for purchasing masks for the public. And is there anything else anyone wants to mention? Okay, seeing no hands waving. So thank you both very, very much.
So, hey, Mayor, before we move on, I'm sorry. So overall, you all feel comfortable with the presentation that staff made with those tweaks and suggestions and comments, but overall moving forward as presented?
That was what I understand.
Okay, good deal. Thank you.
Okay. We will move now to agenda 5D, receive a report, hold discussion, and give staff direction regarding an update on the 2020 census field operations and local outreach efforts. And we're going to welcome our city planner, Elena Chafin.
Hi, thank you, Mayor. Good evening, Council. Tonight, we're going to go over some census updates. We're going to start out by just talking briefly about an accurate count and the impact that would have on our community. I know a lot of you are already familiar with the importance of the census, but I'm just going to give you a little bit of background for the people watching at home. We'll go over some of the changing deadlines and field operations for 2020 census. We'll look at some data and some updated response rates, and then we'll go into a little bit about what the city's doing and some local outreach efforts that we've been conducting. So at this time, I will share my screen. I'm gonna do it soon. Promise. Okay. All right. Can everyone see the presentation?
Yes, ma'am.
Okay. All right. So why is the census important? I know that several of you know that the census is one of the most democratic processes that we have in our nation. It counts everyone residing in the United States just once and in the right place. It determines the number of representatives that Texas gets in the U.S. Congress. It also determines redistricting data. So not only federal representation, but the number of representatives that our area or our region gets at the state level. It also is important to our quality of life because it determines several $1 million in federal funding that communities get that are based on data collected by the census. These are federal programs that include reduced lunch programs, SNAP benefits, and even Pell Grants and federal housing. It also helps ensure that our economic development growth continues to thrive. It provides data that is essential for businesses to determine where to set up shop and where to expand their business, which creates jobs and more opportunities for Nacogdoches residents. Before we get into the data counts and the field operations, we're going to talk a little bit about what we're up against as a community that's specific to Nacogdoches. When we look at the historically hard to count populations across the nation, these include children under 5, immigrants and non-English speaking populations, minorities, college students, and low-income households. And Nacogdoches checks all of these boxes. Whenever we look at the demographic makeup of our community, about 7% of our population is under the age of 5. 50% is of color, and about 31% live below the poverty line. So not only is Nacogdoches hard to count just in general because we have such a large demographic of hard to count populations, but then you add the pandemic on top of that, and it just makes the issue even worse. But we are working through that. Just to give you an idea, about 25% of Texans live in hard to count areas. These are more pronounced in your rural areas, but just to visually demonstrate, this is an issue in several communities across Texas, and Nacogdoches is no different. All right, so just to give you an update on some of the things that we've learned from Census Day, a lot of these responses were submitted online. A lot of them were data that was collected from frequently asked questions on the hotlines. One of the primary concerns was that a lot of people believe that you actually have to have a census ID in order to respond to the census form, which is not true. And when people get the paper form in their mail, it comes with a census ID form, but people can respond online, they can respond by phone, and all you need is a physical address. So it is important when we talk about the census to our community to remind them that they don't need a census ID. They can respond by a street address, rural address, or other physical location. Another frequently asked question that came up after the Census Day is the Hispanic origin and race question. So the census not only asks you your race, but it also asks you your Hispanic origin. And a lot of people were confused by this and were wondering, well, I already responded that I was Hispanic or Latino. Why am I now being asked to provide additional detail about Hispanic origin or Latino designations? And one of the reasons why the census asks this question is one, it helps guide decisions in public and private practices. It also ensures fair representation when we look at reapportionment and redistricting, and it helps reveal some of the disparities rooted in historical discrimination in some of these areas. And so when we talk about Hispanic versus Latino versus Spanish origin, a lot of people identify themselves with one or more of these designations. Hispanic or Spanish really talks about Spanish-speaking communities or people who are from countries that speak Spanish, whereas Latinos is more of a geographic designation for people that are from Latino countries. And so the answer is you can identify as more than one, Hispanic, Latino, or Spanish, but if you don't pick one, the census will pick one for you. And so really it just helps reveal some additional demographic data. It's not used against anyone. It's not used to identify specific individuals. It's more for demographic data. All right, now to talk about some key operational changes. So some of you might remember that when the 2020 census first started, the deadline was July 31st. And then in March, COVID-19 hit, and then everything got turned upside down. And so initially, the 2020 census, the Census Bureau extended the self-response deadline and field operations to October 31st. And whenever they did that, they also submitted a request to Congress to extend the statutory deadline for submitting data to the president and submitting the redistricting data to the states by 120 days. And so the idea was we're going to extend our field operations so we can collect better data. But Congress, we're also asking you to give us an extension on this deadline for submitting the data to you. And so over time, those requests were not approved. And so Census Bureau said, we're already past the deadline for providing accurate data, so we're going to have to cut it short to September 30th. And so now we have 4 fewer weeks to get out the count. And what that means is that everything that we're doing, we're just speeding up a little bit. Census employees are conducting in-person non-response follow-up. They started on August 11th, and there will be an additional paper questionnaire mailed out in late August, it'll be mailed out in mid-September, but it won't be mailed out to everyone. It'll be mailed out to those census tracts that have the lowest response rate today. The Census Bureau is also sending out emails. They're making phone calls, and they're sending text messages. And so if you hear someone say, I got an email from the Census Bureau, is this legit? Well, it's not spam. They're actually sending out blast emails, text messages, and phone calls to people who haven't responded to the census yet. So as far as non-response follow-up, census takers will be going door to door from 9 a.m. to 9 p.m. local time. They will present an ID with a name badge, a photograph, and a Department of Commerce watermark and expiration date. You'll be able to identify them because they'll be wearing a mask, and they'll have a census bag with a Census Bureau issued electronic device, and they'll also have a sticker on their car that says Census Bureau official business. And so we've already gotten a couple of phone calls from people saying, someone knocked on my door about census, but they weren't wearing a mask. Well, they probably weren't a census taker. And so there's a hotline that we're providing for people who are asking those types of questions, and we can provide that to the council as well about how to identify census official if you're confused about if someone knocking on your door is actually from census or not. But those are some key indicators of how to determine who's a census taker and who's not. If they can't contact someone at the residence, they will leave a notice of visit. And if they essentially can't contact anyone, then the Census Bureau will rely on administrative records to collect data from that household. All right, so we'll look at the data. I did send you guys some percentages and some self-response rates, but those have been updated since I sent them to you in the packet. So I do have some new numbers for you, and we'll look at those. So the overall self-response rate across the nation right now is 65%. In Texas, it's about 60.4. For the city of Nacogdoches, it's 53.9. So overall, we are about 10% behind the national average. We're about 7% behind the state average, with Texas being 38th as far as ranking in the 50 states. As far as the county level, Nacogdoches County is at 52.4%. So they're just behind the city at 53.9. You can see on this image, the darker blue and the lighter blue counties are those that have the highest response rates. And then the light and darker orange are those with the lowest. So you can see that North and Central Texas are doing pretty well, but it's those more rural areas in the West and Southern counties that need the most attention. And they're having the most issues with getting out an accurate count. This is an image from the CUNY Hard to Count map. This is a data map that's put together by the University of the City of New York. It provides daily updates of self-response per census tract. It also gives you a comparison of that census tract or that city compared to the 2010 rates. And so today, our self-response rate as of today is 53.9 versus a 61.9% in 2010. So we are about 8% behind right now, but we've got a few weeks, and so we are planning on continuing our outreach efforts to increase those response rates. In the packet I sent you, I gave you a link to our website. Our City of Nacogdoches website has a census webpage where we've downloaded a lot of downloadable promotional materials for people to use and distribute to their networks. We have recorded PSAs, we have email templates, pre-written social media posts, handouts, flyers, things of that nature. And we are working with the Chamber of Commerce to push out a lot of this data to our local businesses to try to encourage them to to distribute information to their employees and to their customers. We are working with SFA as well. We are working with Pine Log, which is a SFA student publication, to put ads in their ads on their online publication, as well as actually put articles. The Daily Sentinel has updated their website with a banner at the top. You'll notice if you go to the website, at the very top, it'll say it's not too late to respond to the census. There's a couple other organizations that we're distributing information with. We've been working with 21/7, stuffing little goodie bags to distribute to our lower income populations, as well as the continued social media posts that you see online. And like Larissa said, our social media has received a lot more attention than in recent months and even recent years. And so that has been a productive method of getting out the count. I also have to thank Mercedes at the library. She has been essential in getting the count out and helping engage the community and working with other groups, including Amy Mahaffey. And so we've really been trying to think of unique things that we can do and pivot our outreach efforts to online. And before I open it up for questions, I will tell you that I got an update today from SFA. So SFA has been one of the biggest questions that we get about the census, and are the students going to be counted? Because typically what SFA has done in the past is they'll actually get the physical census forms and they'll distribute those to the students who are living on campus, and then the students will respond to the census themselves. Whenever those census forms were received by the campus, the students were already gone. The dorm halls were closed, and so all of the students were displaced. And so the SFA was trying to figure out, how do we get the students counted? We know they should be counted here, but they were displaced due to COVID-19. And this is an issue that all universities have been dealing with across the nation, trying to figure out what information they can share, what they can't, what's considered sensitive, and what they can actually release to the census without violating federal law. So whenever I talked to SFA today, I talked to the Dean of Student Affairs, and she said that they were able to release all of the necessary census data for the students who are living on campus as of March 31st, before they sent them home due to COVID-19. And that includes about 3,300 students. And that actually is not reflected in the self-response rates to date. And so we are very relieved to hear that, that at least we'll get those on-campus students counted. And once those numbers are recorded, that's really going to boost our percentage rates, if not put us where we were at the 2010 final self-response. So some good news in light of all of the COVID-19 challenges that we've been facing. And so with that, I'll open it up for questions.
And thank you very much. Mr. Hens.
So as you were going through this, I was trying to remember. I remember getting the form, and I'm 95% sure I did it back in April. How do you know if you've done this or if you've completed it already? If I were to go to the census.gov site and try to do it again, would it kick it back out? Is that because I don't remember?
That is an excellent question. You know, I haven't had that question, and I haven't tried to actually do that. Am I still sharing my screen, or can you guys? No.
No, it will not let you do it again.
No. Okay. I didn't think so. I was going to actually just try to go to the website real quick and see if it would let me do mine. I'm sure you'll get some sort of error message. I did mine online, and then I got a little certificate. So I assume if you try to use the same address over, I'm assuming you'll get a prompt or message or something that says, hey, you've already filled out your census form. But that's a great question. I haven't been asked that, but because it's tied to your address, I'm assuming it'll recognize that and it won't let you do it again.
Yeah, I received a notice that I had not filled out my census, but due to the location, there's two buildings on the same lot that I own. I had filled it out for one of the lots, for one of the homes on the lot, and not the other one because no one was living in it. So when I went back, I said, well, I'll just go back and look and see if my first one that I done was good. And it stated to me that I already had filled it out. But if I went to the other place where no one was living, it showed that it needed to be filled out. So, but I got something in the mail about that place also. So.
Okay.
The only other thing I was curious about is, so the numerator is those number of people that have indeed filled it out for the self-reporting. What's the denominator? Is the 2010 census data, or is it some other privately city or county produced information of an estimate of what we actually think we have in 2020?
Yeah, so excellent question. So a lot of that is based off of 2010 data coupled with a addressing canvas that we provided to the Census Bureau later last year. And so and I'm trying to see if I can find exactly when it was. So about 6 months to a year before the Census Bureau creates all of their addresses that they're going to distribute the census forms to, they will actually contact local jurisdictions and ask for updated census tract information with an updated address list based on the development within that community. And so in College Station, we had several subdivisions that were under construction and several apartment complexes that had just received certificates of occupancy, but they weren't on the Census Bureau's address list because they were newly constructed. And so when we look at the forms that are being sent out today, it's a combination of what the Census Bureau had on file in 2010, and then the updated information that local jurisdictions sent to them based on new addresses and new certificates of occupancies that we've issued since 2010. So we do provide them new address information, and for some cities it's a really large increase, and for some it's small. So since 2010, we have had some new subdivisions, we've had some new apartment complexes. So we have added to that list of the mailouts that went out.
Awesome. Thank you, Elena.
Okay. Mr. Bolden, did you want to add anything else?
No, yeah, okay. The information being provided by SFA to SFA and to the chamber to get information out to communities will not get to the low-income communities nor the community of color. Chambers are not one of the most popular names that you can find in the low-income community nor the community of color. But most of the churches now that's in Nacogdoches County, as far as churches that's basically predominantly of color, are now doing online service. And to me, that would be a good target, is to reach out to those churches and ask them to put a spot on their church service on Sundays. We got 4 more Sundays to do that.
Yes, and thank you, Mr. Bolden. And we have been working with some local churches or some local groups. Mr. Don Mills is a local pastor, and he's been very engaged and very involved in the local community, especially trying to get out the count for our lower income neighborhoods. I did want to share with you real quick, if I may. I'm going to share my screen, and I'm going to share with you a map. So can you guys see my screen?
Yes, we can.
All right, this is that CUNY map, that hard to count map that I was telling you about. And so this shows you the self-response rate by census tract. And so those darker and light blue areas have the highest self-response rate today, and these lighter orange areas have the lowest self-response rate. And so you see here in the middle, this is the census tract that encompasses the university, outlined in red. And then these other census tracts also have residential neighborhoods, and they include some of our more lower income communities. And so one of the things that we're looking at, that we're going to be doing as a final push, is we're going to be putting together a mass mail out, where we're going to be mailing directly postcards and flyers to these residents in these neighborhoods. But we want to be strategic about it. And so I wanted to show you just very quickly, this map also shows you those households that are going to be getting a final questionnaire in mid-September. So what you see in this darker color red, those areas will be getting that final questionnaire mid-September. So we're going to be focusing our efforts kind of on this southeastern quadrant, and because those are some of our lower income communities, and they are typically hardest to count. And so we are trying to be very strategic. We're also planning an event in mid-September. We're trying to put together a drive-through event where we encourage people to come out and drive through, allow volunteers to come up to their car with an iPad and help them fill out the census. We're trying to put together a raffle for people to enter into, and seeing if we can encourage people to come out. But we know that really we need to engage them directly where they are. So the churches are a great avenue, and I know there are people in the community who have already been working on that, but we are trying to find creative ways to engage that community without actually knocking on their doors. But thank you for that recommendation. We're actually working with Demedia. She's our Census County Coordinator, who is hired by DETCOG, and I know she's been working directly with a lot of local churches and ministers. And I'll follow up with her later this week and see where we're at and see if there's ways that we can increase those efforts to increase those response rates in those specific areas.
Thank you.
Okay. Anything else, Mr. Bolden?
No, I'm good. Thank you.
Okay. Mr. Anderson?
Everyone else has, or others have either asked or you have already answered most of my questions. So beyond that, I'll just say thank you very much for your efforts and for keeping us well informed. I really appreciate it.
Thank you.
Okay. And Ms. Fisher?
Yes, ma'am. Okay, and this is kind of piggybacking off of what Mr. Bolden said. I appreciate that the pandemic has put a lot of strain on the census work, and that particularly falls on your shoulders and on Mercedes' shoulders. You guys have been working so hard on this. And so I certainly understand sort of the move and focus to social media for the very reason that you can't host the events in person. But my concern with that is that focusing on social media leaves out the very populations that we're worried about counting. And with the exception of students, of course. And so I was glad to hear other measures that you guys are taking to target hard to count, traditionally hard to count communities. A couple of other things that I wanted to mention that I'm not sure you guys, and I know that Mercedes works a lot with the Hispanic community and is very experienced with that kind of community outreach. And so I'm sure that she's thought of this or it's already happening, but reaching out to Spanish, to the Spanish newspaper, La Lengua. I don't know if you guys have some sort of an ad running or something that can be done continuously, because that's a newspaper that a lot of people read. I'm just trying to think of other media avenues besides social media, which, you know, is out of reach for a lot of low income populations. And the other thing that I thought of would be flyering businesses, restaurants, businesses where you would expect people still going to, even though we're in a pandemic, to the exclusion, obviously, of having big events there and things like that, but some sort of promotional materials elsewhere besides social media. I think churches obviously is a great idea.
No, and no, I totally agree. We have been working with our local radio stations. Starting today, you should start hearing PSAs on KIX 105, KFOX 95, La Mejor, which is a Spanish station, and Classic Rock 107. We're actually paying for additional radio time and airplay for KFOX 95 because they get the most draw as far as audience. We're working with KTRE to do some local interviews, and they're very good about working with us and trying to get us on whenever people are at home watching. We've also put some articles in the Sentinel, and we'll be continuing to try to go down that avenue. interviews on the local radio station. Like I said, we're going to be doing those mass mail outs where we're going to be sending out postcards and flyers to those addresses that are in those low income communities. We have distributed about 50 of these window clings that say I count to some of our local businesses to put in their windows. I think some discussions that I had with Mercedes, we were going to try to contact some of our local clinics to see if they could provide some distribution of materials to their patients, especially some of those health clinics that are specifically in those areas that demographic uses on a regular basis. And we're also going to be, we've also distributed some materials through the senior center, and we'll be working with the local food bank, just distribute materials that way as well, and doing some volunteer work. And we also distributed about 5,000, oh my God, 5,000, no, 500 separate materials to Nacogdoches ISD to distribute to their employees, because they're one of our highest employers, and they include demographics from across the community, especially in more of their service positions. So social media is a big one, but we are trying to utilize other avenues and other outlets to try to get that information out beyond, you know, having in-person events. But we'll keep you updated on those activities as well. Based on the information that I'm hearing from some of my counterparts and other cities, they get the best bang for their buck whenever local media outlets like radio and television pick up the stories and run with them, because people are tuned into those. And so we're really trying to push that avenue. Local media, KTRE, the newspaper, things that people go to every day for their daily news, especially in today's day and age with COVID-19 and the election. Everyone's tied into those local media outlets. And so thank you for your feedback. We will continue to run that down. I know that at one point in time, our Census County coordinator had approached La Lingua to put a census article in their paper, but I haven't heard from her on that in a while. So I'll reach out and see where we're at. Maybe we can do another one since we're coming up on the deadline. So thank you.
Yeah, and maybe even and I don't know what the purchase capacity is, or if you could work with the publisher of La Lingua, since it's not, you know, a for-profit thing, but maybe some recurring, I've seen the little signs in Spanish, contamos, you count, we count, something like that can be reprinted over and over versus one comprehensive article that somebody might miss.
Yeah, no, that's a great idea. And you can actually pay for, they have banner space that no matter what page you go to, you see the same thing. And so typically those are paid versus them just putting something in the paper. But we'll definitely chase that down and see what kind of cost that would be, and look at our resources and see if maybe we can either get them to donate that kind of space. Sometimes they will, if it's a community program like that. Sometimes they'll donate ad space. But if it is something that we have to purchase, we can look at that too.
Okay, sure, you're good. Okay, so it sounds to me like you, Ms. Chafin, have written down or have made a note of the things that were mentioned, not to overlook. Council wanted to make sure they were included, which included churches and some additional outreach that Ms. Fisher had mentioned. Does anyone have any last words about this? No? Okay, I see shaking heads. Do you need anything else from us, Ms. Chafin?
No, I don't think so. We are we're going to pursue the online services for our local churches, and I'll reach out to some of our local congregations as far as Mr. Mills, because I know he's very connected. I'm going to reach out to La Lingua and contact our county coordinator and see if I can get an update on that. And we'll continue to push flyers and posters to our local businesses. Now, sometimes they don't want us to put information out there, but if they let us, we'll do it. So thank you for your feedback, and I'll keep you guys updated as we move forward.
Okay, that sounds great. Thank you so much.
Thank you.
Ms. Chaffin, could you call me tomorrow sometime?
Sure.
Thank you.
You're welcome.
Okay, anything else? Okay. Well, thank you all very much for your participation tonight. This concludes our meeting of September 1st, 2020.